Hello everyone and welcome back to this platform. Thanks for choosing to spend time with me and also for tuning in to listen to what I have to share today. For those who have been here before, welcome back and thanks for always showing up. I believe you come back over and over to check what new is here. And if you're new, welcome to this platform and hope you feel comfortable and come back and get to share the information here, especially if it will be of benefit to you and you think there's someone out there who could need it. For those who are new again, I'll just give a brief summary. I speak mostly about sleep, or we explore the world of sleep and the different perspectives on sleep. And on today's episode, I would like to take us a bit into the sleep lab and what exactly happens when we sleep, because that's exactly what gets investigated in a sleep lab. So I will attach a video at the end so that you have a glimpse of what a sleep lab looks like, or just a room actually. And I welcome you to ask questions in the comments, or if you have any experiences also you've had in the sleep lab, I welcome you to share about how your experience was and what it felt like to be in a sleep lab, because at times the name makes it sound kind of mysterious, but I know we also have different setups in a sleep lab, or rather the basic setups are the equipment, but every institution probably have their special way of doing things. So I will walk you through what exactly a sleep lab is again, to summarize, and what exactly happens during a sleep study, which is what is mostly done in a lab. There are, in the meantime, also possibilities of having this done at home. There are quite modern equipment which do this, but there's still the gold standard of diagnosing sleep disorders is still spending a night in this sleep lab, or having to be monitored while sleeping in a sleep lab. So that's what's up today. And again, let me just describe. A sleep lab is a facility, medical facility, and equipped with devices to diagnose sleep disorders or treat them. So some of the equipment in a sleep lab are used as well to treat those disorders. And all this is intended to happen either overnight or during the day. There are tests that are done specifically at night and also those done specifically during the day. And these achieve different goals, or they are used for diagnosing different conditions. A sleep lab could be located inside a hospital or medical centers, but there are also independent ones, those who are just established as standalone facilities and have no direct contact to other medical departments. And inside a sleep lab room to say, you'll find a bed, sometimes a TV, a camera, mostly mounted on a wall or roof. And this is used only for recording during the sleep, to record movements or any events that are worth noting or recording, like sleepwalking or just restless movements at sleep. So if you see that in a sleep lab, don't be scared. Don't feel uneasy about that. You should know in forehand that that's to expect, like a video, a recording system, yeah. And people go to a sleep lab if there is suspicion of a sleep disorder, which can range from sleep apnea, chronic insomnia, unexplained daytime sleepiness, narcolepsy, restless legs syndrome, and parasomnias. Actually, this episode kind really timely because I'm in the process of doing a preparation for an event which will be hosted at the end of the month on rare diseases. And these, one of them, like narcolepsy, is a rare sleep disorder. So it doesn't really happen. Not so many people have it, but it still is a medical condition that affects the quality of life. There are people who have sleepwalking, night terrors, or acting out dreams. And all this is categorized under sleep disorders. And just because some of these conditions, again, are rare, doesn't mean they are not real or they don't exist. Yeah. And poor sleep has been linked to several other conditions like heart disease, high blood pressure, diabetes, depression, anxiety, and memory problems. And a sleep study helps to establish sometimes what the relation all these have to these the conditions I've mentioned. The main test done in a sleep lab is called polysomnography. Simply put, measuring of sleep from different spots on our body, like the measuring of different functions of the body during sleep. Let me see it. So I think that's much clearer. So as polysomnography measures different body functions during sleep, and that's why during a sleep study, the multiple sensors are put on different parts of the body at the same time. So it could feel like it's a lot going on, but that's to expect again, because some of the conditions interrelate with each other or show, like, before you rule out one thing, you have to at least have everything under one picture so you can look them closely, what affects the other. And a sleep study not only shows how long you sleep, but how well you sleep. So once this data is collected, it's analyzed by a specialist, and the analyzing helps to evaluate what happens to your brain and body while you sleep. And the main signals, or rather sensors, majority of them are on the head. So that explains the reason why, if you listen to the previous episode, the brain gets the most out of the sleep we get. So if the sleep is not as restful or as a good quality, the brain gives the fast response. And what happens actually on the night of a sleep study, most labs admit the patients in the evening, ideally a couple of hours before the usual bedtime, to allow room for mounting the electrodes and also paperwork if they've probably been forgotten or haven't been done, and also just to relax. I uploaded a video in one of the, I think here also, on some of the essentials you can take with you to this lab. On this day, on a night you spend on the sleep lab. So if you can go back to, it's just a short video, like literally a short. So if you can have that time to go back to that, you can see the essentials I've summarized: comfortable pajamas and your own pillow, toiletries, essentials like charger, phone charger, and like a book if you're someone who reads before you sleep. Those are some of the things that you need to take with you to have a comfortable night during a sleep study. Different labs have different routines, but generally make yourself comfortable when you get there. Ask questions if anything is unclear, because that's what I feel like what most people miss out on. A sleep lab is not like a military training where everything is on command. If you don't understand anything, it's good to ask questions and to have that clarified to you. Most of the time, there are several staff on the night, medical staff, technician, and they all are well versed with what's going on or what needs to be done. So feel comfortable and ask question. And actually, the regular routine is when you get admitted, a staff explains usually what's the procedure or what to expect. Some already mount the sensors as soon as the patients come in. Some give you time, or some wait till it's just before your bedtime. So depends on where you are. But ask and get to feel comfortable, so that then that also alone, the fact that a lot of things are new and happening and what you didn't expect doesn't stress you out and make your sleep actually worse. And yeah, one thing I would also advise is there are mostly own bathrooms assigned to each room, just for the sake of comfort, and that's how actually it should be. So once you get there, you need to freshen up and change, because sometimes the dirt and the oil and the creams that are on the skin, they affect how the sensors are going to stick or stay intact after being attached. So clean up the surface of your skin to allow for later on when the technicians or the nurses do mount the sensors. This will also make your night easier, because nobody will have to come in and out of your room to fix anything. And the sensors on the head, mostly, I think I've already mentioned, are used to track the brain waves, the eye movements, and also and the muscles, so the jaw muscles activity. There are also sensors monitoring the heart rate, the breathing, and the oxygen levels. Actually, a very important thing I think I need to mention is this whole process is not painful, should not be painful. If in any case you experience any discomfort or pain, you need to let the staff know, because that could mean that something probably is not fixed well, or something is not sitting in its proper position. But the electrodes are actually made flexible, like the cables. If you are in a lab that still use maybe the old-fashioned way, which are cables to do the polysomnography, they are actually very flexible and mostly long enough that should allow you the flexibility to toss and turn or move around at night. So that should not be your worry, or should not make you also sleep like stiff during the night for being worried about the cables or the sensors coming off, unless it's really like a rare situation where one is extremely restless, then the sensors will come off. But normally they're usually really attached well, that they should also allow you to sleep through if you don't make much movements. And so the brain sensors, or rather the head sensors, are the ones that are also used in determining the sleep stages, the different sleep stages that we go through. The deep and REM sleep, which is rapid eye movement stage, are some of the main, and also the light sleep are the main sleep stages that go in a cycle of about 90 minutes throughout the night. So once these are recorded, they are also used to stage the sleep, or look at how the sleep develops throughout the night. And the ones at the eye actually are used to confirm the rapid eye movement. They track the movements of the eyes, and that also help in the sleep staging and like confirming the REM sleep especially. There are also belts around your chest and abdomen which measure the breathing effort, And the oxygen saturation is usually measured using a small clip on the finger. I've had a couple of complaints, especially from, actually it's not even gender specific, but there's some people who probably have fingers that are sensitive who complain about the oxygen clip, the sensor. Again, if anything is uncomfortable or causes discomfort at night, please don't hesitate to mention this to the staff, because otherwise you will end up not having a really good sleep, and that can lead to misdiagnosis. The sensors on the legs, they monitor the leg movements, which is helpful in diagnosing conditions like restless leg syndrome or periodic limb movement. There is actually also a microphone, mostly attached to the flow sensors, or rather breathing ones, or the chest sensors. Depends on the setup of the lab. Some of them are just independently somewhere mounted on the room or on the camera. These ones, they help record the breathing sounds, which, especially snoring, is a very good pointer if there is something not going well during sleep. All this information gets transmitted to a monitoring room where normally a technician or a nurse monitors the data in real time. So throughout the night, in normal setups or in normal situations in a sleep lab, there should be someone in the lab with the patients monitoring these sensors and ensuring that everything is in its right position, because there's no need of putting the patients up all night and the sensors are not working, because that will end up causing more costs and also more, just more time in coming back to repeat. So it's advisable to have someone, if you're running a sleep lab, who monitor those sensors, because it all runs down to that. A lot of people do actually sleep better in a sleep lab despite all these things. Whichever the reason is, I cannot explain that, but I'm just saying this so that in case someone is anxious about their stay in a sleep lab, be comforted that it's not as bad or as alien-ish as it sounds or feels with all the sensors I've mentioned. The goal is not to have a perfect night actually, but rather to get data from your sleep that the doctor can use to make a diagnosis. And once you get to sleep, a sleep technician monitors the study anyway, so in case of any issues, there are usually ways to communicate and to fix this, either with phones, or some just require signals like just switching on and off lights. So that should not worry you again, that in case something comes off or in case the study doesn't go as you plan. Should you need to use the bathroom, which happens a lot or is at times for some people a norm, this should also not be a problem if that's the case for you. At night, most rooms, again, in a sleep lab should be self-contained, that accessing a bathroom should not be an issue. And the procedure is usually also explained during the admission, whether the staff need to come and stop the study from recording, or if you can just stand and go and continue with the recording. This is again from lab to lab different. In some cases, if there is severe observation that conditions like sleep apnea, which is breathing pauses, treatment is usually initiated immediately and the same night. This is what is typically called a split night study. So that should also again not scare you in case you go to a lab for just a regular checkup and then you get woken up and like, hey, Mr. or Miss so-and-so, you need to use a machine. That probably could be the reason. And again, normally there should be an explanation, but at least you've heard from here that something like that can happen in case the severity of the breathing pauses is extreme. And in the morning, once the study is recorded or everything, all there, in the morning, usually again that depends from lab to lab, but let me say around between 6 and 7, a technician removes the sensors, and typically you are free to go home. In some cases, in case you need to do a daytime study, you'll just be woken up during that time, and you need to stay up 1 or 2 hours before the next daytime study commences. So, and this daytime study is what is called the multiple sleep latency test or the multiple wakefulness test. They do get recorded during the day, and mostly at least 1.5 hours, 2 hours after waking up. The data collected, all this during the day and night, are reviewed by not only a technician but also by a sleep doctor specialist, which at times can take days or weeks, depends on the routine of the lab or the capacity. A follow-up appointment to review the findings and treatment options also is then arranged after this the study has been reviewed. In ideal situations, actually the appointment should be offered on the night of the sleep study. So before you leave the lab, you need to ask, or also you should be knowing what comes next. The treatment will depend on the diagnosis of the condition in question. Just a few examples. Typically for sleep apnea, the first line of treatment is CPAP. That's what is recommended and also like the gold standard, but there are also options like oral appliances. Lifestyle changes could also be a treatment, surgery, or tongue pacemakers. All these depend on the severity and also the case. There is no one size fits all for the treatment of sleep disorders. So just so you know, you cannot in most cases say, yeah, I know someone, they went to the lab, they got this, I also want it. The reason everybody gets whatever they get depends on the diagnosis and the severity of what they got. So it's very unlikely that you get this. You need to get the same as what someone got. Their doctor or their physician or their specialist they were seeing probably made the decision based on what they saw and they had. Conditions like insomnia usually have treatment like cognitive behavioral therapy for insomnia, which is shortened for CBTI. Narcolepsy and other neurological sleep disorders may require medication and structured sleep schedules, which is also what I keep emphasizing, because a condition like narcolepsy gets really worsened if the amount of sleep depth, let me describe it. If you have like less, you'll sleep less and less, or your sleep is more disrupted, the severity of a condition like narcolepsy gets worse. So if you will go to a doctor, you have already known that you have a condition and they suggest something to you, don't be offended that they've done the bare minimum, but it's just also one of the very useful ways of getting to deal with that. I hope I've mentioned everything, or the key points of what goes on in a sleep lab. That sums up what I had in store in this episode. I hope that it's helpful to those who've listened or tuned in. If you've been struggling with sleep, maybe this could be your sign to visit a sleep lab and get your answers. Sleep is not a luxury, it's actually a necessity. So if you got to listen to this and you haven't done anything about your sleep, or you suspect you have something, maybe look around for the nearest sleep lab. There are options of doing the study or test both at home and also in a facility. If this episode helped break down or demystify some of the information you've heard about a sleep lab, share it with someone who could be also on the process of making the appointment. And don't forget to subscribe and like or leave a comment. Thanks for listening and for spending this time with me. Until next time, bye.